All right, hello friends. Welcome to your Sensory and ADHD webinar. So this is designed for you if you're a parent and your kiddo's struggling with a sensory issue or an ADHD issue, or maybe you're even a practitioner and you work with these kiddos and you want a better understanding of what's going on with their brain and their nervous system. Because when you better understand what's going on with your kiddo or the kiddo that you work with, you have a better idea of what to do to help. And one of the reasons, so we're going to talk today about these two, one of the reasons we put them together is that there's a lot of overlap with what's going on underneath the surface. And obviously, a lot of times what alarms us as a parent is some sort of symptom, right? Our kid's hyper. They're not focusing, paying attention in school. They've got behavior issues. A lot of times with sensory pieces, they might be defiant, they might be stubborn, they might avoid new things. And a lot of times it's this symptom that drives us to look into things more. And what I'm passionate about is sharing what you can do to better understand what's going on inside your kiddo's brain. We're pretending this is a computer tower here. We'll go into that more in a moment. But when you can better understand what's going on inside your child's brain, then you're better able to help. And some of you I know watching this are practice members that we've seen for a while, and you're looking for more information to better understand your kiddo. Some of you might be watching this for the very first time and even wondering, like, why is Dr. Ty, who owns Whole Family Chiropractor, why is the chiropractor talking about sensory and ADHD issues? And it's something that we're super passionate about in our practice. I've been in practice since 2007, and what I've loved studying is the brain and the nervous system and kiddos. So over 40% of our practice is kiddos, and a lot that we see are in these categories here. And it's something that is often to the things that we teach and share with parents in our office. A lot of parents have these like aha moments because it's actually something that makes sense to them. Something that they've been looking for. Maybe your kiddo is on an ADHD medication, let's say, and you're looking for an alternative to that. Or you're wondering like, oh, my kid's been diagnosed with ADHD, but I think he might actually have a sensory issue. Or you're looking for the better understanding in order to better help your child in a holistic and natural way. So that's what I'm excited to share with you today. Now, as we go through things, I know you can't see it here, but I've got some different handouts that I'm going to show and some different outlines to help paint a picture, because obviously pictures work well to explain things. And I've got some notes here to make sure I cover everything that we need to cover, and most importantly, stay in an order that makes sense to you guys. So what we're going to talk about as an overview then is what I started alluding to is a lot of times the symptom is what drives the concern. And what we have represented here is a monitor on a computer screen. And the monitor shows us a picture of what's going on inside the computer, and more importantly, even like was typed in the keyboard. And before I actually finish this, just so you know, if you're watching this live, feel free to type any questions or comments in the chat box. And if you're watching this as a recording and you have a question, feel free to type that in too, and I can always jump back and respond later. And make sure you give it your appropriate thumbs up or likes. To let me know that you're enjoying this. So anyway, if you type in a word, say you type in ADHD into the keyboard, that goes into the computer and it shows up on the screen. And if you were to type in ADHD and on the screen all of a sudden showed up like a pink elephant, you'd be like, what the heck's going on, right? You'd kind of wonder, like, that wasn't what I typed into the keyboard. But here's the deal. You wouldn't get mad at the monitor, right? You would want to backtrack a little. You'd say, well, clearly the monitor's showing me a picture of a pink elephant, but I typed in ADHD. So either I typed something in wrong or the computer isn't doing what it's supposed to do. And that's what we're going to look at today is these are two of the biggest factors that we're going to discuss to help you understand internally what's going on inside your kiddo's brain. So we're going to start with, from the environment standpoint, some of the things that are more common, because what does make sense from a computer analogy here is that if stress is in the environment, if the computer perceives stress, if the brain perceives stress, it makes sense that stress is the output. And if our kiddo's feeling stressed, if they're displaying stressed behaviors and they're in a stressed environment, That scenario makes sense. But what about the scenario where you're working really, really hard as a parent and you're trying to set up your kiddo in this really nice environment? You're watching what they eat. You're making sure they're around people who care for them. You're limiting screen time. You're trying to make sure they're getting out and exercising. And you find maybe you're walking on eggshells and you're putting a ton of energy into the environment, but you're still getting a stress response. Or one little thing in the environment's off, and it kind of makes this whole meltdown process that you've been trying to avoid the whole time. So what can be a hidden piece in the environment, and what can be something that is going on in your kiddo's brain that is affecting things? So to go into that, I want to first cover some of the environmental pieces that we look for that are a little more common to give you context here. And this is something that we're going to go over briefly because most of you, I find if you're watching this, you've already done a lot of homework. You've already been looking on Google and talking to friends and on moms groups or parents groups, and like you're saying, all right, I got the basics, I need something more. So that's why we're going to go through this more quickly, but it's going to help you understand your kiddo in the context of their brain and their nervous system. So your kiddo's brain receives different things from the environment. So the environment is pushing inputs into your kiddo's brain. We have, let's actually start here. This is most kind of easy to explain. Chemical stress, right? If something's going in your kiddo's body that stresses their nervous system, that's going to create a stressed output. For example, my wife, years ago, if she would eat gluten, she would become anxious and nervous and depressed. So that stress caused her brain to feel a certain way. If you've ever had a lot of caffeine and you feel that anxious or jittery feeling, it's the same thing. Now, for an example here, we know that dyes, like artificial colors, for some kids, their bodies don't like them at all. In fact, over in Europe, there was a study that came out of the UK that showed how artificial colors and dyes can stress a kiddo's brain. And so they actually required a warning label to be put on. If you put like red number 40 in a food, you have to put a warning label saying this could cause behavior issues and affect their brain. So if you go to Europe, most of the like candies or things that might have an artificial color here in the US, they use natural colors over there because they understand that that's a chemical stress that can stress the brain and affect the brain. When we jump over here, we've got, bring this up for you guys, emotional stress, mental and emotional stress. The biggest thing here is that when your kiddo is growing, so my kiddo right now is almost 20 months, and of course he's at the stage where he watches everything my wife and I do. And if he sees us do one thing, he wants to do the exact same thing. Well, even as your kiddos are older, they have what's called mirror neurons, and they want to mirror their environment. So if the emotional stress is coming even from, say, the household or from school, from their teachers, from other close people to them that are, whether it's kiddos or adults, if there's stress around them, that's going to tell their brain to react with a similar level of stress in their body. And as I'm explaining these things right now, we're giving some examples that might not exactly be just for sensory kiddos or just for ADHD kiddos, but I want you to understand the context that if stress is in the environment and is going into the brain, that's going to lead to these symptoms such as these issues. So the better the environment is, the brain can be set up for healing. And that's one of the most important things that I want to emphasize, is that it is possible to change your kiddo's brain for the better. If they've been in a stress situation and are responding with a stress response, it's okay. We're able to get them out of that fight or flight, get them into a healing mode. We're going to jump over here. Technology stress can be something that irritates kiddos. We know that EMFs are very stressful for the nervous system because they're a similar wavelength. We had one kiddo had a combination of both of these and would always wake up super grumpy. We referred him to someone that works with EMFs, and he set up their house in a different way, actually put this protective sheet over his bed, and this kiddo started waking up in a good mood. He was like 8 years old or so at the time. because that EMF at night, it was such strong Wi-Fi and such strong EMFs in his area, his nervous system never got a chance to rest. And if your kiddo's nervous system never gets a chance to rest, it never gets a chance to heal. So that's something that is very important, is knowing that, especially at night when you're sleeping, you want to make sure that you can turn off your Wi-Fi, put your phones on airplane mode, make sure there's not electronics in the room, but have your whole house in a calmer state is going to help your kiddo's nervous system be in a calmer state when they wake up the next day. The other thing with technology, especially with kiddos nowadays, where we have iPads, as part of their schooling, what happens is that's a lot of sensory input into their brain. So if your kiddo, and this is going to apply to sensory and ADHD together, if your kiddo has a sensory issue and let's say certain lights or certain sounds overwhelm their brain, they're going to be even more sensitive to that technology. And you may have noticed that with your own kiddo. If a kiddo has an ADHD concern, they're also going to be sensitive to technology from a screen standpoint, because what happens is there's this thing called a sensory motor loop. Sensory information goes into the brain, and the brain has to do what's called a motor, which is movement, output. So if your kiddo has lots of screen time, then what happens is their body is designed to want to move to release all that sensory input, because it's basically like all this energy has gone in, kind of like if you drink a lot of caffeine and then you're stuck sitting in your chair. Like there's all this energy in there and it's moving around and it's got to be let out. So that's where this technology can come into play, is you want to make sure you're giving your kiddo good movement time afterward. And also one of the reasons why you don't do screens before bed, because you just put all that energy in the brain and it's got to move to get it out. And Glenda, I see you're asking about children using blue glasses. Yeah, I think it's a good idea. Blue glasses help filter, or it's glasses to filter the blue light from computers, which is stressful on our cells. It's stressful on how our cells make energy. So that would, Glenda, especially be important later in the day when the sun's starting to set and you want your kiddo's nervous system calming down. And if they still need to have screens later in the day, then that's especially important to have generally like an orange tinted glasses to help with that. I have some myself that I wear at home over my glasses. All right. And then the last stress is the physical stress. So we're going to talk about this more in depth, because this is often one of the underlying stresses that can turn on fight flight inside your child's nervous system, inside their body, and leave it stuck on. So for those of you excited on the science side and the more technical terms, which I personally always get excited for, we're going to talk about some new terms for you there when we talk about the physical side in more detail. But as a starting point, I want you to be just looking at your kid's posture, right? And especially nowadays, I was just talking to a mom this morning who has a 10-year-old, and she's like, yeah, especially with the pandemic, there's way more of this screen time. And what happens is if you're in this posture, now if you look at me here, what is my brain likely feeling, right? If I'm upright like this, it's likely that my brain is going to feel happier, feel in a better mood, able to want to focus better and handle different sensory inputs better. If I'm stuck down like this, our physical posture actually feeds into our brain and is going to make it feel more down, more depressed, more nervous, less cooperative, and more likely to create some of these symptoms that we're talking about. So different stresses come in to the brain. On a sensory standpoint, what happens there is sometimes there's a stress from the environment that's normal for one kiddo, but stresses another kiddo's brain. We talked before about light and sound. When your kiddo's born, there's a reflex. It's called the moral reflex, where if there's a bright light or a loud sound, it causes them to startle and causes them to come in and relax. As an example, if that gets stuck on in their nervous system, when they get to be a little bit older in life, you might notice them not wanting to go, say, to the movie theater, or different sounds, they kind of get startly, or lights, they startle them. and it's triggering this same fight-flight response that it did to a newborn if it never got healed along the way. So that's an example where something for the environment might be normal for one kiddo's brain, but another kiddo's brain, if they have a sensory issue, is causing that stress response, that fight-flight response in the body. The other thing, another example there might be some kids, they're very ticklish. And there's another reflex that babies have when you swipe their spine, it causes them to wiggle, and it helps them wiggle their way through the birth canal. If that reflex never integrates later in life, you might see a kiddo who's trying to sit still in a chair, but if the chair bumps their back just right, it actually forces their brain to wiggle. And they have to work really hard to sit still because that is a stress in their environment, causing their brain to need to tell the body to wiggle. So you might see a kid that's tried really, really hard to sit still in his chair. It might look like ADHD, but it's actually a sensory issue. So what we want to do then is understand, like, okay, what does it take to help your kiddo's nervous system heal? And that's what we're going to look at here. And the thing is, if your kiddo's nervous system has been experiencing some of these different stresses, and over time, these stresses have caused the brain to feel stressed, what can happen is now the brain starts feeling stressed, even when these things are taken away, or they're, like, as a parent, a lot of parents we see in our office are working really hard to start to minimize some of these, right? You say, well, I am watching what my kid eats, or we do limit screen times, or he does get lots of movement. What's going on in that situation? So the next piece then is, you might wonder, well, if I feel like I have the environment under control, is it actually something wrong, we'll say, with my kiddo's brain? And if you do hook a kiddo's brain up to, say, EEGs, and you measure the brain waves, yes, a kiddo with ADHD is going to have a different brainwave pattern inside, going on inside their brain. The good news, however, is if we take a step back, we want to ask the question, like, well, how did our kiddo get to that point in the first place? So if your kiddo's brain does feel like it's set up for ADHD, or you're noticing these sensory issues, a lot of times it's because there was something in the environment that was triggering this fight or flight, this stress response, that maybe the environment's changed, but the brain is still in that stress state. And as a result, it's not able to heal the way it's supposed to. So the next thing we're going to transition into here then is, what is something that can be in the environment going into your kiddo's brain that you don't see, right? That's not one of these obvious topics that we were just discussing. Because if it's something that you can't see, then it's very tough to be able to do something about it. And that's where, as a parent, you might hit that level of frustration of, like, I think we're doing it all, but why isn't my kiddo changing? And this is something that is what we help most common with in our office. So I'm going to get my next set of pictures here for you. There are two main senses that go into the brain that were not taught in school. Two main senses that aren't from our external environment that we can see, right? If we think of sight, smell, sound, taste, touch, those are the five senses we're taught about in school. If our kiddo tries to put their sock on and the seam's not lined up and they freak out, it's easy to be able to see that, oh yeah, their sock's the culprit here. Or the things we talked about before, they're in the environment, they're easy to see. However, there's two senses coming from inside the body that go up to the brain that we don't see. One of them you may have heard of is the vestibular system. It's in the inner ear, and it helps our brain process when we're moving. So if your kiddo doesn't like going on the, let's say, the teeter-totter, or like a tire swing that goes around in circles, or maybe your kiddo gets car sick really easily. Maybe they don't like if you throw them up in the air and catch them, you see them at the top and they're freaking out. Sometimes in our office, we'll take a kiddo and we'll slide them on the table, and we see them kind of like grab the table. that's an indication that that part of their nervous system isn't processing the environment well. And this is super important for the brain because in order for the brain to feel safe, it has to feel like it can handle the environment. And what do I mean by that is, imagine if you were walking down a set of stairs, and every time you were walking down the stairs, all of a sudden you got really dizzy or you felt like you're going to faint. You wouldn't casually walk down the stairs. You would be gripping the railing, and each step you took, you would be super cautious, or maybe you'd plop to your butt and kind of like scoot down the stairs because you knew if you got dizzy and fainted and tumbled down the stairs, that wouldn't be a good thing, because our brain spends a tremendous amount of energy keeping us upright, keeping us moving around in space. So vestibular is one of these senses that comes from the environment into our brain that we don't see. The other sense is something that you may be familiar with. It's called proprioception. P-R-O-P, prop for short. So proprioception, or prop, comes from all the joints and the little muscles. There's a lot in our wrists and our ankles, and that allows our brain to know where our body's at in space. It's why if I stand on one leg, I don't fall over. It's why if I shut my eye, I can still find my nose even with my eyes shut, because this prop, this sensation, allows my brain to know where my body's at. And as a result, it allows me to stay connected to my body, and it allows me to feel calm and grounded. If my brain doesn't know where my body's at, if I try this and I'm up here or over here, guess what happens when I'm moving through space? If I try to pick up a cup of tea, if I try to open a door and step off onto a curb, I'm not going to do that very well, and my brain's going to freak out. So the reason I'm sharing these two pieces is they are super common to be huge factors in the realm of sensory and ADHD. And you might have, for example, taken your kiddo to OT. That's one of the things OTs often assess is, how is their vestibular? How is their proprioception? How are those early reflexes that I talked about before, where right when they're born, are they still doing this little wiggle? Because if those things aren't working properly, guess what? That's going to send stress into the brain and cause a stress response, even when the rest of the environment is super safe, is super calm, is super relaxing. And that is often one of these big missing pieces. So to go into that more, I promised you guys some science words. We're going to look at now, what does this mean from the chiropractic sense? And since we're not OTs in our office, what do we do different from that realm? And what do we see as contributing to these hidden pieces in the environment stressing your kiddo's brain? So the first picture here is a puzzle piece, and as you can see, it's out of place. What we work with, obviously, as a chiropractor, is we're checking the spine. We're looking to see how the alignment of the spine is and if it's doing what it needs to do. Now, a lot of people, they associate chiropractic with neck and back pain. If something's out of place, maybe it causes neck pain or headaches. But what we're looking at is actually less worried about if there's pain or not. I know we help with that, but we're looking to see, what is it affecting in the brain? So the first big word, and I didn't write it down here because I don't want you to get too distracted, but there's a word, it's called disafferentation. Disafferentation is what happens to the brain. Actually, I'm sorry, we'll jump one word before that. Dyskinesia is when something's out of place. So if something in the spine's out of place, it's not moving well, then we're going to jump to the next big word, which is disafferentation. What happens is when something in the spine's out of place, it starts to send stress from the body into the brain. So a lot of people think about the spine as good for movement, but the research that's been coming out over the last several years is showing how important the spine is to help keep the brain happy. You see, when the spine's out of place, when there's that big D word called dyskinesia, something's not moving well, it sends stress into the brain. And one of the main ways this does this is by limiting the word we talked about before, the proprioception. So if something's out of place in the spine, It's not getting good prop, it's not getting good movement. The brain's less aware of what's going on in the body, and it starts to send stress into the brain. Now, when there's stress going into the brain, obviously that's going to create a stressed output, right? So we get something called dysautonomia. Not going to worry too much about that word, but basically what that means is your kiddo's fight-flight response gets stuck on. If the brain feels stressed, it says, there must be stress in my world. It causes fight-flight to go on inside your child's brain. And guess what? If your kiddo's brain is in a state of fight-flight, they're not going to want to sit still. They're not going to want to behave when you're in the grocery store. They're not going to want to cooperate. And if their cup is already close to overflowing with stress, it's going to be a lot easier to have a meltdown or a tantrum. So when fight-flight's stuck on in the brain, then we get the last piece here. One more big word, Dysponesis. And again, we're not worrying about the big words, but what it does to the brain, it actually creates a disorganized brain. So I want you to think about the last time you had a lot to do. Maybe you were about to take a trip, maybe, especially recently, maybe you're getting ready for spring break. And you had your huge to-do list, and you had to run some errands, you had to pack your suitcase, you had to make sure this thing was up to date or the bills were paid, whatever it is. You have this huge list to do, and you have a time deadline to get it done by. When your brain is stressed with all that to do, it's really easy to become disorganized. So this is then when we tend to see that kiddo that is not very coordinated. Maybe they don't like going on the playground. Maybe they're a little tumbly. Maybe they missed some milestones where they didn't crawl well and they went straight to walking. All those things can be an indicator of a disorganized brain. It doesn't always get to this point because sometimes it's more just back up a step or two. Your kiddo's brain is really stressed and they just like to empty that energy and run around all the time. However, for those of you whose kiddo is, maybe they're struggling with reading or math and you're seeing like, yeah, it feels like something's just not clicking in their brain. It very well can be because something in their environment is stressing their brain and preventing it from getting into that calm and healing state. So we're going to look into this here to summarize. When the spine's out of alignment, it causes the brain to be stressed, and that's neurologically proven. The good news is also with studies I'll share here in a little bit, when they've hooked EEGs up to kiddos' brains, they've found that when you adjust the spine, it actually helps the brain activate this front part, which allows things to calm, to ground, but more importantly, it allows your kiddo to start to pay attention when they need to pay attention. Think a little bit more before they act out. When we can take this stress out of the brain, it allows this, it's called the prefrontal cortex, the front part of the brain, to start to become more online and more active. If your kiddo is constantly living in fight-flight, that front part of the brain that allows us to make good decisions never has a chance to receive information to start to get turned on. You see, when your kiddo's really little, this part of the brain is hardly doing anything. That's why like little kids have temper tantrums or the terrible twos. That part of the brain is like just starting to want to engage, but if it doesn't get a good chance to, it stays stuck in this fight-flight. It stays stuck in always being active. It stays stuck in and never having a chance to organize, but stays disorganized. The good news is that if you're watching this as a parent, your kiddo's this front part of the brain doesn't fully mature until the mid to late 20s. So the good news with that is there's still some time to put in the work, I guess is what I want to say here, is to not feel like you're stuck just where your kiddo's at. Because if you feel like you're stuck, you say, well, let's just do this with him for the rest of his life. Maybe you have him on a medication, and I'm not saying that's a bad thing, but maybe you want to get him off. And when you realize that your kiddo's brain is still changing until the mid to late 20s before this front part fully matures, it gives you that level of hope to know that, yes, if you keep working at things now, there's still time to help your kiddo. So I want to give you some clues then to know if this could be happening in your child. I'll talk about in a little bit. There are scans that we do in the office. This was a 7-year-old girl who actually didn't wear socks. She had a lot of stress in a certain area of her spine. That's one way to tell if this stress from the spine is happening in your kiddo. But I want to give you some other ways too to help you know as a parent that, oh yeah, this might have started earlier on. The title when you registered for this, we talked about the perfect storm. And where that comes from is that there's some of these environmental stresses that maybe happen early on in your kiddo's life that now when they are 6, 7, 8, 9, 10 years old, it's been long enough that you don't connect the dots. So, for example, if pregnancy was really stressful, it starts to put that into their nervous system early on. One mom that we saw her kiddos after they were born, she had twins. The baby on the bottom didn't move. They basically stayed in the same position for the whole last trimester, and the baby on the bottom came out and her head was already crooked, the poor little girl. And so she came out with things already out of alignment simply because she was stuck in that position in the womb before she was born. When your baby is born, what we want to talk about are how the birth went. Was labor really long? Was there assistance needed with like forceps? At least myself, I was born with forceps. They definitely don't do that much nowadays, but maybe there was suction to assist your baby coming out. One mom worked with her son a while ago. Her pelvis, instead of baby's head being able to go through, her son's head got stuck in the pelvis. So what that means is with each contraction, instead of progressing, each contraction was pushing his head into her pelvis and it wasn't going anywhere. And if you're a mom watching this, you know how intense a contraction is, right? It's not just a little squeeze, but you have all that pressure pushing on a little newborn's neck. And the upper neck is one of the most critical areas to put calm into the brain. For my own son, my wife's labor was about 30 hours, and we found out later he had a broken collarbone from the intensity of the delivery. And there was a lot of adjusting, a lot of things we had to do to get his nervous system back on track because, quite frankly, after his birth, he was set up to go down this perfect storm of constant stress in his brain. Once your kiddo is born, maybe you look back and you can ask, like, well, how did they nurse? Did they nurse easier on one side versus the other? Did they nurse for a little bit and then you had to give up? Did you try a lot of different formulas maybe because they had a lot of reflux or colic and you couldn't get them to be calm and peaceful during the day? Reflux and colic is often a sign of something that's out of place and it's stressing their brain. So they're looking to find something to calm their brain, looking to get comfortable, but that stress is coming from inside their body. So as a parent, it's really frustrating because you're trying to find out, hey, what's wrong with my little baby? And it might be coming from inside their body. As we get a little bit older, looking at their milestones. If something's out of alignment, often they favor using one side of their body more than another. Maybe you notice they always rolled one way, or they hated tummy time, or they favored one position, but they didn't really like another position. Maybe it took them a long time to sit up. We had a little girl who was 1 year old and still wasn't sitting. She started with our office a few months ago. And, it was like heartbreaking for parents because they've been doing PT for 6 months and their little girl still didn't have the core strength. And she actually crawled by doing this. She used her head, and maybe I can't imitate it in the camera, but she used the back of her head to pull herself along the floor because something was so misaligned in her neck that it wasn't allow her brain to connect to her arms and shoulders and her legs to develop that part of her body. So in her case, fortunately, we've been able to work with her at a young age because now we can get her nervous system connected to her body and her body able to feed good input up into her brain to get her brain back into that calm and connected state. If your kiddo skipped crawling, as an example, or crawled really slowly, that can be a sign that something wasn't quite syncing up and that sometimes some docs might not make a big deal of it, but crawling does help set your kiddo's brain up for more balanced, builds the foundations of the brain for later in life for learning and reading and paying attention in school. As you keep going on, maybe your kiddo had that real big fall. Maybe they had stitches or a concussion or a broken bone, something that really jarred things and got stuck there. One mom brought her daughter to us when she was 3 years old. She said at 1 year old, her daughter fell, got stitches in her chin, and since then, she was always grumpy. So in that case, what happened is when her daughter fell, it shifted something out of place, and her brain got stuck in that fight or flight response. Now, she was 3 years old, so it wasn't really showing up as something like ADHD, but it very well could have by the time she got to elementary school. So being aware of those different physical stresses can be a big piece. Continuing on, just looking at things like digestion. When the body is in a state of go, 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 when that fight or flight is stuck on in the body, it slows digestion. So kiddos tend to be more constipated and not go to the bathroom as easily. They tend to get sick more often because that energy is going towards fight or flight, and the immune system gets put on the back burner. Some kiddos, if that upper neck is off, which is by far what we see most commonly from the birth process, it affects the drainage from the ears. So if your kiddo had a lot of ear infections when they were young, it's often because something here is blocking those tubes from draining and causing fluid to build up. Maybe your kiddo had tubes put in and now it did start the drain process, but if it didn't fully clear out, all of a sudden you see their tonsils and adenoids starting to swell up. Or those got taken out and now something's draining into their lungs for asthma, allergies, breathing issues, bronchitis, pneumonia. We sometimes see that pattern. All those might be clues that there was something off early on that never got fixed or never got addressed. So when you start to understand that these stresses in your kiddo's life can add up, what it lets you know is that there's a reason for things. And that's what we're most passionate about in our office, is to sit down with you as a parent and say, okay, tell me about your kiddo. Tell me about your pregnancy, your labor and delivery. Tell me about what's been happening. And sometimes when we put on our detective hat, we start to be able to look back and see these patterns to say, yes, I know your kiddo's dealing with this scenario right now, but let's trace it back. What was happening earlier on? And the good news is when we can identify different things that have been stressing your kiddo's brain, and more importantly, something that maybe has had their brain stuck in that fight-flight response, what it means is if we can identify that, we can start to shift their brain to more calm, which not only helps in the short term, but more importantly, it starts to put good input into their brain for the long term, as their brain is still healing and developing, to make sure we set it up to be able to change and heal and get back on track. Because just because your kiddo has one of these diagnoses when they're young doesn't mean they have to keep that diagnosis the rest of their life. The brain can change, the brain can heal. So let me jump in here then. I mentioned before that aside from the history pieces that we just talked about, what are other ways to really tangibly tell if there's a hidden stress in your kiddo's body that's affecting their brain? So this was a 7-year-old girl with a lot of sensory issues. She, as I mentioned, wouldn't wear socks. She had one pair of shoes that she liked to wear that actually felt comfortable for her brain, and she'd only wear clothes that were a few sizes too big because anything that was tight-fitting stressed her brain out. So we did scans on her. What we want to see are these white bars here. That means that those connections between the brain and the body, those nerve channels, are doing what they're supposed to do. If we see color, and I'll show you here, we have mild, moderate, severe is green, blue, and red. That means those are areas of the nervous system that are under stress. And if they're under stress, they're going to stress the brain out. As you can see here, that upper neck has by far the most stress. Some lower down. Those happen to be really common areas after the birth process because of how the head sits on the neck and how the neck sits on the shoulders. When there's a baby's being born, even in a normal birth, there's over 60 pounds of pressure pushing on their head to have them come out of the birth canal. So the good news is, even though we don't like to see that, we also knew that we could help this little girl. So we started adjusting, and as we're going along, I looked down one day, I'm like, hey, you're wearing socks. She's like, yes, I am. And mom was excited. And pretty soon she was wearing different shoes. Pretty soon she was wearing shirts and pants that fit her. And pretty soon it felt like her sensory issue wasn't running her life anymore. Now this is a follow-up scan, and sometimes the stress shifts. So what we see here is that whole area up top is being minimized. There's a little bit left to deal with, but overall it's in a way better state. There was an old pattern that was coming up to the bottom here, but the most important piece, that upper neck, was clearing out, and that's how her body was able to heal. It wasn't because we treated her sensory issue. It was because we found where there was stress in the environment that was stressing her brain and preventing her from healing. Once we cleared that old stress out, guess what? There was new input going into her brain. New calming input, more grounding, putting the brain into a healing state rather than a stress state, which allowed then her body to do what it was supposed to do. Because your kiddo's body knows how to heal. If they get a cut, if they get a broken bone, it knows how to heal. So the good news is, just like they know how to heal a broken bone, they also know how to heal their brain once it starts getting good input from the body. So in that little girl's case, we found where the area that was out of alignment, when we got it back in alignment, it started to put some calm into her brain, allowed her body to get out of fight or flight and start to feel more grounded. And as a result, her brain started to feel more organized, and it could start to handle those sensory inputs that were always there, but handle them in a new way. And the good news is, if you are kind of wondering, all right, this sounds like I'm interested, the adjustments themselves in our office are very gentle. We do a neurological approach, so there's no twisting, turning, popping, cracking like you might commonly see in a chiropractic office, but it's a very gentle, we use a little instrument called an integrator, and it does a click, and it helps open up those nerve channels and get things back the way they need to be for healing. So as I wrap up here, if you already are in our office, I hope this was insightful for you to be able to understand your kiddo a little bit better. And if you're watching this and you haven't been in our office before, please reach out. I'd love to see what your kiddo scans show to see if we could help. If you have watched this to the end, it helps us save some time in the office explaining what we do and how this does affect the nervous system. So just mention that you watch this all the way through, and we'll give you $50 off your first visit. Normally it's $150 to do the full assessment, but we'll give you $50 off as a thank you for watching this, because we know it saves us some time in the office. If you're not in the Twin Cities, I know a lot of good chiropractors that work with kiddos, that work with the nervous system. And if you're looking for someone outside the Twin Cities, please message me as well, and I'm happy to find someone to help you out and to do that same assessment on your kiddo to see if they can be helped. So thank you so much for watching. Appreciate you being here with me today, and know that it's very possible to change your kiddo's brain for the better and set them up for success in the future. I'll see you soon.